Welcome to Real World NP's Clinical Pearls, where we take gems from full-length episodes and break them into quick, digestible insights. I'm Liz Rohr, family nurse practitioner, and my pronouns are they, she. Real World NP is a continuing education company for nurse practitioners in primary care, especially new nurse practitioners navigating the role transition from RN to NP. Whether you're on your commute between patients or prepping for an exam, these bite-sized takeaways can help you build confidence in your practice. Let's dive in.
Oh man, another highly requested topic today is about billing and coding. This can be super confusing, especially as a brand new nurse practitioner. We don't really talk about it that much in school, and you kind of have to learn it on the job. So in this video, I'm going to be breaking it down, talking specifically, zeroing in on office visits in primary care. A couple disclaimers before I start. Number one, I'm talking about primary care only. I'm not savvy enough to talk about skilled nursing facility, long-term acute care, or hospital-based medicine, because that's just not my expertise. So if that's you may want to skip this one. Disclaimer number two is that I'm not a billing and coding expert. I'm a self-taught nurse practitioner who has also gotten guidance from billing and coding. I'm using the CMS evaluation and management guidelines, which I'm going to be linking down below, but that's what everybody uses to kind of justify their billing codes. The third thing is that there are many different kinds of types of visits you can bill for in primary care. So number one, what I'm going to be covering today, because it applies to the vast majority of visits you're going to see in primary care, is office visits. And you might say they're all office visits. However, there's different billing for preventative health care, meaning a physical, a well child check. There's definitely a different one for a Medicare physical. And then procedures are a little bit different as well. So because the vast majority is office visits, I'm going to be focusing just on that today. However, I'm also planning on doing a preventative video if that is of interest to you, and how to maximally accurately code your billing. I'm not talking about manipulating or gaming the system to get like the most of your money. I'm really talking about accuracy, because people tend to want to underbill or overbill, and really it's just important to get the facts and document and bill appropriately. So I'm going to share my screen with you to make this really easy, but a couple of notes first. Number one, there's a cheat sheet down below this video with a couple of tables, examples, and references. And really the absolute easiest way, absolutely go through and watch and listen to this. However, the easiest way to get a handle on this yourself is to practice. And it doesn't take that much time. It takes a little bit of time, but it doesn't take that much time of going through some examples, figuring out what the billing code would be based on that. And then once you have that muscle memory of having done that a couple of times, it'll be way easy. Three things. Number one, when it comes to billing at the end of your visit and you've got your note done, you're going to think about the charge. The first thing you're going to think about is your level of medical decision making. And basically what that means is how much of your brain are you using? So is this a very simple allergic rhinitis that you can treat with over-the-counter medication versus is this an acutely decompensating person with CHF in the clinic that you're thinking about sending to the ER? Those are very different levels. Just stick with me, I'm going to break this down. You kind of stratify it based on that medical decision making is what it's referred to as, and it's a level 1 to 5. So level 1 is the least acuity, so somebody, for example, who has allergic rhinitis and you prescribe them Flonase, which is available over the counter, versus a level 4 or 5 with those more complex patients. So medical decision making is your very first thing. Number two, what you want to think about is how do you support it with your documentation. Start with the medical decision making, and then just make sure that your number that you're submitting, that you've chosen for your medical decision making, is backed up with the appropriate amount of documentation, which you'll see in just a second. Stick with me. And number three, when it comes to office visits, there's two other branch points. One is are they new or are they an established patient in your practice? So if they've never been seen there before, they're a new patient, or if it's been greater than 3 years, versus if they've been seen in the last less than 3 years, then they're typically an established patient. And the reason that's important is because new patients typically reimburse more money because there's typically more work involved, but that also means that you have to document more to kind of support your case of why you get to charge for that higher amount of money. So let me jump in and I'll share my screen with you.
Okay, so just a quick recap. So number one, you're going to start with your medical decision making when it comes to billing your E&M codes, which is again, those level 1 to 5. You're going to think about if they're new or if they're established, and then you're going to just make sure that all of your documentation is there to support it. And it actually is you're going to find that it's a lot less than what you think it is. So I'm just going to go over starting with established because those are the most common codes you're going to see.
And so level 1 is typically a nursing visit. The prefix is always 992, and then the last two numbers are the things that are different. So 11 is a nursing visit. 99212 is a minor problem, for example, allergic rhinitis, things like that. And I actually have a whole table. If you haven't downloaded the cheat sheet already, it has the table of risk that is in the CMS guidelines. It talks about all the different examples, not all of them, but it's not comprehensive, but you can kind of extrapolate based on what the examples that they gave you are. And then also the different tables that I have put together based on the guidelines, and then the data that's been published after, which I'll show you in a second on this presentation. But definitely download that if you haven't already. So 99213, the level 3 is, for an example, is an acute illness like a cystitis or one stable chronic illness. And then level 4 on 99214 is 2 or more chronic illnesses, or if a chronic illness is worsening, or for example, if you have an undiagnosed new problem with an uncertain prognosis like abdominal pain. And then, I'm sorry, that should say 99215. That's a severe exacerbation. And I've actually never coded for a level 5 in primary care. And you'll see when you look at the table of risk, looking at the different, assessing the different options, the different examples that are there. Typically, those patients need to be cared for in the ER or the hospital setting. And I felt conflicted over the years about, do you code for that a level 5 because you're sending them out, or do you code them only a level 4 because you're not doing that level 5 intervention because you're sending them out for that? So definitely get clarity in your own practice with your supervisor or with billing and coding. I've never really gotten any feedback about my incorrect level 5s. So I just don't have any, I guess. So those are the established codes, and E&M codes are basically the same for new in terms of your medical decision making, which again I keep talking about because that's the most important thing. It just requires more documentation. So it just ends in 01 instead of 11. So 99201, 99202, 203, 204, and then 205. So again, when you're looking at your billing codes, you're deciding which one to pick, you're going to start with your medical decision making. And I'm actually going to toggle over to the cheat sheet that I made. Well, first of all, I'm going to toggle, we'll start with the one that I made. So at the very top, what you're going to do is, again, this is talking about medical decision making. And this is literally, when I talk about practicing, this is exactly what you can do on a sample of your own notes or somebody else's note, and check off the boxes to see if they actually qualify for the billing code that they chose.
Enjoyed this clinical pearl? There's even more valuable insight in the full episode. Click the link in the description to hear the complete discussion, packed with practical tips to strengthen your skills and confidence as a nurse practitioner. Don't miss it. And if you found this helpful, be sure to like, subscribe, and share with your fellow NPs so we can keep learning together.